Almost a year after the country witnessed one of the longest-running doctors' strike, the medical fraternity is bracing for yet another industrial action.
We do not want a strike, but we are not incapable of it.
The lecturers and employees at medical schools, colleges of health sciences and departments of health at public universities had been set to benefit from the allowances that the doctors' union had negotiated for and received in the collective bargaining agreement of 2017 that was signed between the union and the national and county governments. That hasn't been implemented to date.
This matter is actually an indication of mismanagement of staff in the health sector, particularly those who teach in the public universities. They are entitled to these allowances. These are negotiated and registered allowances that actually are being earned by others. It is therefore not easy to understand, very difficult, so to imagine that 1 year later you have people who have not benefited from the same thing that the others are enjoying.
The failure to pay out the allowances to the lecturers mean that the government and the universities now owe the over 650 people affected over 800 million shillings. Now the lecturers say they want their money.
Kiwango cha pesa ambacho kila daktari ambao ni mwanahadhiri ama lecturer amekuwa denied is for lecturer it's 70, for professors it's 70,000 and for senior lecturers is 86,000 per person. Sasa ni pesa, sio pesa kidogo, sio pesa kidogo sana, ndio maana ni arrears kutoka last year.
The lecturers also double up as specialists are pegging their pay demands on the return to work formula signed in March 2017 between KMPDU and the Council of Governors and the Ministry of Health that saw doctors awarded risk and emergency allowances. The Ministry of Health has, however, indicated that the specialists who also teach are not eligible for the award of the allowances.
This has also been the tradition, so we are not asking for something new. This has been the tradition since the 1990s. That every time the Ministry of Health doctors get allowances, it's also given to doctors who are lecturers. It happened in 1994, it happened in 2003 with the non-practicing allowance, it happened in 2011, you know. And so these are not new things actually. So let it not look like it's a new demand.
If they make good their threat, the country's referral and teaching hospitals, Kenyatta National Hospital, Moi Teaching and Referral Hospital, Jaramogi Oginga Odinga Teaching and Referral Hospital, as well as major county hospitals will be partly paralyzed.
This time around it has taken over 1 year, and unfortunate for the country, it may actually take the closure of medical schools, and it may take the closure of some of these our national referral hospitals for this to happen. So we have given a 14-day strike notice. On 15th of February, that strike will begin unless these things are paid in arrears. And as you know, we don't say what we don't do.
The two unions are also accusing the government of discriminating against lecturers in the awarding of the allowances, since other practicing doctors, pharmacists and dentists are already receiving the same allowances. Brenda Wanga, NTV.